Hello, I'm Manesh Patel, the head of cardiology at Duke University. Atrial fibrillation is one of the most commonly encountered disorders of the heart rhythm. It's caused by abnormal electrical activity which makes the upper cardiac chambers, the atria, quiver inefficiently instead of pumping blood with a powerful beat. AF is a global problem and its prevalence is increasing. Older populations are particularly likely to develop AF, and if you're aged over 80, there's a 1 in 10 chance that you have it. Because atrial fibrillation makes the heart beat less efficiently, the reduced flow of blood may result in the formation of clots. If a clot embolizes, it may end up in the brain, causing an ischemic stroke. In fact, having AF makes you 5 times more likely to suffer a stroke. What can be done to reduce that risk? For the last 70 years, physicians have relied on oral anticoagulants, blood-thinning medications that help prevent clots from forming in the first place. The story of these revolutionary drugs begins one freezing afternoon in February of 1933, when a dairy farmer called Ed Carlson drove 200 miles through a raging blizzard to visit the biochemistry lab of Carl Paul Link at the University of Wisconsin. On the back of the farmer's pickup truck was a dead cow, a milk can full of its blood, and 100 pounds of rotting hay. The cow had died from sweet clover poisoning, a mysterious condition first noticed 10 years earlier. When cattle or sheep ate spoiled hay made from the sweet clover plant, their blood slowly lost its ability to clot, and they would eventually bleed to death. It was 7 years before Link and his team succeeded in isolating the compound responsible for these clotting problems. They called it dicumarol, and it was soon adopted as the first oral anticoagulant. Carl Paul Link went on to investigate the properties of over 100 similar molecules, and among them he found an even more powerful anticoagulant, which he realized would be an ideal rat poison. He named it after the organization that funded his work, the Wisconsin Alumni Research Foundation, or WARF for short. Marketed as Warfarin, his discovery was a huge commercial success. It turned out to be equally effective as an oral anticoagulant, but only when physicians finally overcame their qualms. Carl Paul Link used to joke that doctors who had no problems prescribing cow poison for their patients seemed reluctant to treat with rat poison. Warfarin is a type of drug known as vitamin K inhibitor. It works by binding to VKORC1, a protein essential for synthesizing prothrombin and other clotting factors. First prescribed in the early 1950s, warfarin greatly reduced the risk of stroke in patients with non-valvular atrial fibrillation by as much as 2/3. Clinical trials consistently showed that it was the best oral anticoagulant available. It remained undefeated in comparisons for more than 50 years. But warfarin is far from the perfect drug. Correct dosing can be difficult, and it requires blood testing. Other prescription medications, even eating certain types of vegetables, may prevent it from working properly. Possible adverse effects include nausea and abdominal pain, and most seriously, major bleeding, which can lead to disability or death. This risk has led some physicians to prescribe low-dose warfarin, which reduces the chance of major hemorrhage, but does little to mitigate the danger of strokes. It's only in the last decade or so that better drugs have come along. In 2009, a major study called RELY showed that large doses of a new oral anticoagulant, dabigatran, reduced the risk of stroke in AFib patients without increasing the risk of major bleeding. In September of 2011, the ROCKET AF trial, a trial that I had the pleasure of working on, demonstrated in a blinded fashion that rivaroxaban was non-inferior to warfarin for the prevention of stroke or systemic embolism that reduced fatal bleeding. Just a week later, the results of the Aristotle trial proved that a third drug, Apixoban, was another superior alternative to warfarin. Not long afterwards, the Engage trial showed similar impressive results for edoxaban. These 4 trials, which included more than 70,000 randomized patients, show pretty conclusively that the new drugs are better than warfarin. And yet, 10 years on, warfarin is still the most commonly prescribed anticoagulant for patients with non-valvular atrial fibrillation. In fact, 2020 will be the first year in more than 50% of the patients will be receiving a drug other than warfarin. Why has it taken so long for this antiquated and unsatisfactory medication to fall out of favor? Physicians have a tendency to stick with drugs they're comfortable with and understand, and to prescribe doses that minimize side effects rather than maximizing survival benefit. More than 60 years ago, Carl Paul Link, the scientist who discovered warfarin, expressed his frustration that doctors often got stuck in their ways. Link believed in the importance of breaking what he called the usual pattern of thought, adding that sooner or later, and usually sooner, the truth will conquer. A decade after NOACs first appeared on the scene, maybe that moment has finally arrived. Join me, Manesh Patel, as we continue this journey, from the birth of anticoagulants through the history of antiplatelets, up to the recent revolution in therapies that have fundamentally changed our understanding of how clots are formed. This is a story about how the leading doctors are using new evidence to improve the lives of millions of patients.